Hello, welcome to my channel today. Gerald Massa, my name's Pregnancy Solutions, and today we are going to talk about one thing that is so common. This one thing is this: the pregnancy test is negative, but you are pregnant. What is really causing this? You go and do the pregnancy test, it turns out to be negative, but deeply inside you, you're feeling pregnant, you're feeling all the signs of pregnancy. You're vomiting, you're actually nauseous, whatever you're eating is coming back. Come with me today and let's find answers to this question. You may be pregnant, but the hormones are still low. Amongst the first causes of you feeling pregnant but the test being negative is this: the hormones. Specifically, we are looking at a hormone called the human chorionic hormone, or the HCG hormone, may be low. So you don't need to worry about maybe what could be happening. The main thing is this: it could be due to low hormonal levels. And without further ado, we shall go to our next cause of you feeling pregnant, but the test is telling you, Nana, it's negative. You may not be pregnant, and there could be a cause. This is so true in women who are having issues in their reproductive system. These issues may include growths. These are growths like fibroids, or even a pregnancy not being in the uterus. So you may go ahead and do the test. It turns out negative, but still you're feeling really all those signs of pregnancy. You don't need to worry, there could be another cause. The next point is this: you realize that you may feel pregnant and the test is negative because you might have drunk a lot of water and the urine HCG is diluted. Remember, we talked about the urine HCG hormone being present in urine. This is very true. When you are to do this pregnancy test, please do it in the morning when the urine is still concentrated. When the urine is still concentrated in the morning, we presume that the human HCG hormone is really in high quantities, and this is the best time for you to do the pregnancy test. Next point is this: you may be pregnant, but something may be wrong. This something could be anything to do with disease. It could be anything to do with probably it could be sickness. So you may need to go and have some tests done on you. May need to go and talk to your doctor, and once some tests are done, then there could be any other problem causing you to feel as if you're pregnant. So whenever you're feeling pregnant and the test turns out to be negative, please don't assume that it is pregnancy. Go to your doctor and let them do some tests on you. Thanks a lot, my friend, and let's move on to our next point: why a woman feels pregnant but the test is negative. This may be because the hormones are still low, as we talked about it. So the only way to confirm is you may go ahead and do a blood pregnancy test. It's called the blood HCG test. This can assess all the levels of the hormones, the HCG hormone in your blood, and then of course we may get a better plan. The pregnancy test errors: waiting long to read the results. The pregnancy test may give errors just simply because you did the test, but you took long to read the results. We always advise that as soon as you dip in this pregnancy strip into the urine and it gets in contact with the urine, please remove it and give it just a few minutes, roughly just a few minutes, and the test, as soon as it reacts, then make sure that you read your results. Don't wait for so long. So our point is this: when a woman does the test, when you do the pregnancy test, please don't wait for too long. Just read the results immediately. Thanks a lot. And the next point is, actually it could be due to the expired HCG pregnancy tests. The test kits may be expired, so make sure that you read the expiry date. Make sure that these test kits are very valid, and then we shall get good results. Thanks a lot, my friend, and let's move on. Next is the poor storage of the pregnancy testing kits. If at all the place you went to buy these tests, was really a drug shop or your local store or even your pharmacy, they know how to keep these pregnancy test kits. But as soon as you bring it home, please make sure that you keep it in dry places, far away from direct light. just make sure that the storage of these kits is really very adequate, very sufficient. If at all the storage is poor, you put it somewhere and it is in contact with maybe moist places. There's even water which is on the floor, which is in that area where you've kept it, then there are high chances that it's going to give you false negative or false positive results. So storage of the pregnancy test kits is very important. Next point is this: if a woman is expecting twins, normally because of the high levels of the HCG hormone in the blood, the pregnancy test may tell you that it's negative, and yet you are expecting twins. So you may feel pregnant, the pregnancy test tells you you're not pregnant. Main reason, you may be expecting twins. And how this happens: when you are expecting twins, the levels of the HCG hormone are very high. Normally very high levels of the HCG hormone tend to give results which are false. So just make sure that you correlate or you compare your results with the doctor's results. You need to go to hospital and they will do some tests. They can actually go ahead and do an obstetric ultrasound scan on you. This will show that you have twins. Thanks a lot, my friend. And the next point is this: the HCG hormone doesn't react with the anti-HCG chemicals in the HCG kit. It's very possible this could have happened in the factory, in the factory where they manufactured the pregnancy test kits. They might have manufactured them and probably they didn't put the anti-HCG chemicals adequately. Maybe there was an error, there was a human error, maybe there was a machine error. We've seen this a lot. You buy a packet of tablets, you reach home, and actually some tablets are missing. So don't really blame it on yourself. It could have been a factory error, it could have been a machine error when they were making these pregnancy test kits. So always make sure that you correlate, go to hospital and let them repeat the pregnancy test for you. Thanks a lot, my friend, and we shall go to our next point, and this is ectopic pregnancy. Ectopic pregnancy is defined as a pregnancy which is outside the uterus. It is extra-uterine. It's just outside the uterus. This could be very true because once the pregnancy is outside the uterus, let's say if the pregnancy is in the fallopian tubes, then there are high chances that the levels of the HCG are going to be very low, because ideally where the pregnancy is taking place is not where it's supposed to take place. So ectopic pregnancy or pregnancy outside the uterus, that is in the fallopian tubes, it could bring about false negative results. You test, no pregnancy. Test, no pregnancy. The only way to confirm an ectopic pregnancy is please always go to hospital and let them do an ultrasound scan. An ultrasound scan will be able to identify and tell us that yes, the pregnancy is in the fallopian tubes. And remember, seriously, this is an emergency. It's an emergency, and it's an obstetric emergency. Make sure that you be worked on very fast. The doctors know what to do once they confirm that it is an ectopic pregnancy. Then they will tell you the next care. But please don't stay at home. If they tell you that it's an ectopic pregnancy, you have to get immediate medical attention. Thank you once again, and let's move on to our next point. There's what we call the gestational trophoblastic disease, abbreviated as GTD, gestational trophoblastic disease, or molar pregnancy. The pregnancy was growing, it was growing normally, but it ends up actually forming what we call vesicles. This is not really a normal pregnancy, and it can actually go ahead and give us very wrong results. You test, you're getting all the stomach is increasing in size, you're getting all the vomiting, the nausea, all the signs of pregnancy, but the test is telling you it is negative. The only way to confirm this once again is please, you are advised to go and do an ultrasound scan, specifically an obstetric ultrasound scan. It will tell us that this is a molar pregnancy or a gestational trophoblastic basically disease. So please, my friends, just make sure that you always seek support. The other reason is the HCG hormones may not react. We've already talked about that. please, the only way to confirm this is you have to repeat. Remember to like and subscribe for more of these pregnancy tips. I will make sure that I send you the notifications. You will be the first to know when new videos are out every day. We release videos every day about pregnancy. Anything related to pregnancy, this is the best channel. And remember to ask me all your questions down below in the comments. I will answer them personally. Like and subscribe today and you will stay in touch with me. I will be very happy to connect with you and answer all your questions. Thanks a lot, my friend. And yes, without wasting time, I'm really so happy that you stayed with me and listened to really what we've just talked about really understanding really what could be causing the feeling that you're pregnant and yet the test is telling you that you're not pregnant. So I hope you take this in 2 points. Whenever you feel pregnant and the test is telling you you're not pregnant or the test is showing negative, those are some of the reasons that could be taking place. Thanks a lot, my friend, and have yourself a fantastic day. Bye bye and see you again.